Welcome back and happy 2025. This year, we are going to try to jazz up Medicare just a little bit. I know that a lot of times fumbling through all of the Medicare information makes you want to have a drink anyway, so we're going to teach you how to make some. So, first and foremost, Medicare open enrollment is here. So, much like mixing the perfect mojito, it takes careful consideration and the right ingredients. So today we're going to go ahead and first we're going to make our drink, and then we're going to talk about what you need to know about open enrollment, when it lasts from, what you can and can't do, and how the changes in Medicare Part D are going to impact you in 2025. So mojitos are always a very fresh, a little sweet, a little sour cocktail. They taste fabulous. As you may know, they have mint, lime, sugar, white rum, club soda, and ice. So let's go ahead and dive on in. So we've got some mint leaves prepared here. We're going to just briefly muddle them. And then I'm going to add a little bit of lime juice. And generally, I would recommend you add 2 teaspoons of sugar, but for ease sake, I'm going to add a splash of simple syrup. Let's go ahead and that together a little bit. You don't want to over muddle the mint leaves. So from there, I've got my recipe here. From there, we're going to go ahead and add 2 ounces of rum, white rum. And we're going to add some ice. And of course, feel free to add more or less ice, depending upon your taste buds. And we're going to go ahead and top this off with some club soda. From there, I'd recommend, a couple of stirs and then a little bit of a lime garnish. Go ahead and squeeze that. Go ahead and enjoy. Well, now that we have our cocktail mix, cheers. Let's go ahead and talk about Medicare open enrollment period. So, first and foremost, what's a Medicare Advantage plan? We've recorded many other videos on this. I'm sure a lot of you know, but as a quick reminder, a Medicare Advantage plan is one plan that covers all of these things. So it's your Part A, your hospitalization, Part B, the doctor or medical side of things, Part D, your prescription drugs. These plans typically include extra benefits, dental, vision, hearing. A lot of times they include a gym membership. And as a reminder, Medicare Advantage plans typically are little to no monthly premium, but you have copays throughout the year for everything you do. And these plans also are network-based. So you have to go see in-network providers if you're on an HMO. If you're on a PPO, you can go in and out of network, but you pay a little more when you're out of network. So that said, the question we always get is, what is open enrollment period? Most people know what the annual enrollment period is from October 15th through December 7th. But what is open enrollment? So let's go ahead and talk about that. So open enrollment is January 1st through March 31st. This gives you one opportunity during the first quarter of the year that you can change your Medicare Advantage plan. So you have to already be on a Medicare Advantage plan, but this gives you the chance, if you didn't change during the annual enrollment period, or as an example, if you were waiting to see if your insurance company came to an agreement with some hospital system to see if they were going to stay in network. There's a lot of different reasons you might want to consider switching plans during the open enrollment period, but you can do so one time during this quarter. Very refreshing. So, one of the main reasons we wanted to talk to you about this today is there were significant changes in the Part D drug plans for 2025. And so we're seeing a lot of people that are interested in switching potentially their Medicare Advantage plans because of the changes in their Part D drug plan that they maybe didn't realize were coming. So for example, one of the things the Inflation Reduction Act did for Medicare was institute a $2,000 cap or maximum out of pocket for what you'll pay for your all of your prescription drugs throughout the year. So there's no more donut hole. That has ceased to exist. Your Medicare Advantage plan might change, because of this, things like your formulary of all the prescriptions covered on your plan, the out-of-pocket max for the entire plan, both your medical and prescription combined, some co-insurance, some extra benefits. We've just seen a lot of changes in the Medicare Advantage plans for 2025. partly due to the Part D prescription drugs. So really we recommend the annual notification of change, or excuse me, annual notice of change that came out in September. Really recommend you review that, but the fall is kind of crazy. If you didn't get to that, now is your opportunity to go ahead and take a look at these plans one more time. So that said, I referenced networks earlier. A couple other things we'd recommend you keep in mind. Other reasons to review your MA plan, like I said, is everything in network. This is something that's been a real hot button issue the last few years when it comes to Medicare Advantage plans. Are your drugs still in the formulary? You know, as the insurance companies can charge less and less for these drugs, you know, some of them might be eliminating some prescriptions from the formularies to kind of make up for that. And then last, have your costs changed? The benefits. What's important to you ultimately is really what we recommend you start this analysis with. So let's go ahead and wrap up this one. You know, ultimately, if you choose to make a change on your Medicare plan, you can do so, as I said, from January 1st to March 31st. You can only make one change in whatever you elect to enroll in. If you do so, that'll be the plan that you're on for the remainder of this calendar year. And you could switch again in the annual enrollment period for next year, or we can, begin this whole process again first quarter of next year. Ultimately, whether you have a preference in your Medicare plan, I have a preference in this cocktail. I really prefer the mint over the lime. So to each their own, but really at the end of the day, you have to decide what's most important to you. And that's what we recommend you keep in mind with your plan. So cheers.